Convergent procedure is a two-stage hybrid operation that includes a epicardial, meaning outside of the heart, and an endocardial procedure, meaning inside of the heart. So two-stage ablations. In the first ablation, we make a incision, about a 3-centimeter incision, over the xiphoid process that allows us access to get behind the heart and be able to ablate the back wall of the heart, where a lot of the foci for atrial fibrillation come from. And once we're done with that, then we come over to the left side of the chest and are able to put a clip on the left atrial appendage, where the vast majority of strokes come from in patients with atrial fibrillation. So this is a fairly minimally invasive procedure. Patients stay a day or two afterwards and are then discharged and are then followed up in electrophysiology about 4 to 6 weeks later for an endocardial ablation, meaning where they go in through the groin and are able to ablate any remaining areas that need to get touched up with an endocardial ablation probe. Following that, patients are watched to see if they have any recurrence. And what we've found is that this procedure has much better outcomes compared to the standard management, which is a medications alone or even just an endocardial ablation alone. So in a randomized controlled trial that was recently published, what we found was that patients who underwent the hybrid approach to long-standing persistent atrial fibrillation, those patients in particular did better compared to catheter alone. And what we found was that patients who had undergone convergent procedures, their freedom from atrial fibrillation was higher, both on and off antiarrhythmic therapy. Their overall burden of atrial fibrillation had reduced. And so overall, the outcomes from this procedure were better compared to the standard therapy that we currently offer patients. And the advantage is that with the additional gain in outcomes, we weren't necessarily making a major sternotomy. The approach is still fairly minimally invasive, and that is an added benefit to this approach. So the ideal patient is someone who has long-standing, symptomatic, persistent atrial fibrillation. Frequently, patients have undergone prior therapy, either endocardial ablations, or have been refractory to antiarrhythmic drugs, and are still fairly symptomatic, meaning they're fairly fatigued, having shortness of breath with doing normal activity. And so those patients who are not finding symptomatic relief, those are the ideal patients that can be referred for this procedure, and we've had fairly good results so far. At Hopkins, we have a comprehensive team of electrophysiologists, cardiac surgeons, and cardiologists that can provide a comprehensive, full spectrum of therapies for managing atrial fibrillation, ranging from medications to endocardial ablations, hybrid procedure, and full biatrial open biatrial maze. And so the full gamut is available. And I think it's a one-stop shop for patients looking to get treatment for their arrhythmias or atrial fibrillation.